I'm Carlita and thanks for joining me again. I had a tummy tuck as part of my combined surgery, so I know firsthand what the whole journey looks and feels like, and I'm here today with our wonderful Charlotte to talk through what a tummy tuck actually is.
Hi everyone, I'm Charlotte, our Patient Services Executive here at Pall Mall, and I've seen and supported many patients through their journeys.
Yeah, that's right. So if you've ever thought about a flatter, firmer belly, you might also be considering a tummy tuck surgery. So today we are going to discuss what a tummy tuck really is, and not just what people say it is, but what's involved from start to finish and beyond.
Yes, so a tummy tuck, also called abdominoplasty, is a surgical procedure to remove excess skin and fat from the abdomen, and when needed, to tighten weakened or separated abdominal muscles.
Now, in my experience, it's often sought after pregnancy, weight loss, or with aging, when your body won't bounce back quite as quickly and skin becomes a little bit loose. Now, this was the case for me after weight loss and pregnancy. I'd say it's not a weight loss surgery, but it's a transformation surgery. It's about contour, shape, and removing skin that cannot respond to exercise and diet alone. And let's not forget, there can be medical factors such as separated muscles and hernias that need attending to.
Yeah, so that's a good way to explain, to be honest. So at Pall Mall, we offer different types of tummy tucks: mini, full, extended, etc., tailored to each patient's body and goals. We also see a lot of mums with post-pregnancy changes doing a mummy makeover, combining tummy tuck with other procedures.
Yeah, that was the case for me, a full mummy makeover. But let's just talk about what a tummy tuck is today.
The operation usually takes about 2 to 3 hours under general anaesthetic. On the day, you arrive at our private hospital in Newton-le-Willows, settle into your room, have pre-op checks, then go to theatre. After surgery, you'll stay overnight and be cared for by our nursing team.
Now, an overnight stay is really needed, isn't it? When I was deciding, it did feel like there's a lot to consider, and I was surprised at how much is actually involved. The pre-op checks, the support, and even things like making sure somebody can take you home after your surgery and be there for around 24 hours after. Knowing that made me realise it is a big operation, but Pall Mall made me feel safe and informed all the way through. And I was well prepared thanks to the guidance from the team.
Good point. So you do need someone to take you home and stay with you for at least 24 hours. It's really important. After surgery, you'll leave the next day with dressings in place, sometimes with your draining and a compression garment that you'll need to wear 24/7 for at least 6 weeks.
Yeah, now I think people can underestimate the importance of wearing compression garments, but it helps with swelling and supports healing. Now, you mentioned drains, Charlotte. Can we just explain what this is? I know it's something that a lot of people can be worried about.
Yeah, so drains may be placed at the end of the incision to allow fluid to escape. This varies person to person, and it is your surgeon's decision. Sometimes these are removed before you leave the hospital, or you may return a few days to a week later to have them taken out. It's good to know as well you'll be supported with pain relief, wound care and follow-ups as part of your aftercare package.
Now, good aftercare is really important and was one of the main reasons why I decided to go with Pall Mall. So can we just touch on scarring? I know this is something that a lot of people can be a little bit worried about.
Yeah, so it's such a common question that we get all the time. Scarring is expected, typically a horizontal scar across the lower abdomen, just above the pubic area, but usually hidden beneath underwear. The belly button gets repositioned in full tummy tucks. With more extensive procedures, scars will be larger. Over time, scars fade, often significantly over 6 to 12 months, and continuing to mature even across a couple of years. They won't disappear entirely, but with good care, garments, scar creams, avoiding sun, etc., the appearance improves.
Definitely. Now, I remember when I saw my scar after surgery, it did look very red and quite obvious. But week by week, it did get better and lighter, and I made sure that I followed all the instructions given to me by the aftercare team.
It's also important to note that not everyone is a candidate for tummy tuck surgery. Ideal patients are in good health, non-smokers, or able to stop 4 to 6 weeks before and 2 to 4 weeks after to stop healing risks, close to the goal weight, or at a stable weight, or at least 6 to 12 months, and with realistic expectations. If you plan to get pregnant in the future, your surgeon will talk about the risks of the results, because pregnancy stretches skin and can separate muscles again.
Yeah, so you've got to remember that stretch marks will only disappear if they are on the skin that is removed. and a tummy tuck won't treat internal fat. And these are definitely things to think about. And for me, I waited until I'd finished having children and I'd been on a 2-year weight loss journey. It really was important for me to get as healthy as I could before my surgery.
And that's a really good way to approach surgery.
So I saw this as an investment into my health all round, and it helped me recover a lot easier. So that's what a tummy tuck is, what it does and how it's done, and what changes to expect. Now we have more detailed videos covering things like processes such as consultations to recovery and beyond.